You're 39 weeks pregnant and that cervix isn't budging. In fact, you're hardly even having contractions. What the heck does that mean? Today, I'm going to tell you what to expect at 39 weeks, what to expect from your body and your health care, and then what it means going forward if that cervix is only 1 centimeter.
Repeat, this is not a drill.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
Now, most likely at 39 weeks of pregnancy, your provider has asked if you want them to check your cervix. Now, some providers will say something stupid like, we're gonna check your cervix today, but you always reframe that in your mind. They're asking if they can check your cervix or if you would like it checked. And honestly, at 39 weeks of pregnancy, unless you're curious and you feel like the exam is worth it, you don't need to have the exam. You can refuse it. There really is no reason unless it's something specific about you. Always ask the question if you need it, if you would like to try and avoid it. I actually have a whole video on if you can refuse cervical exams. I'm going to link it down below for more information on that. But some people are having their cervix checked at 39 weeks and some people are not. And most often, if you get it checked at 39 weeks, it's going to be 1 centimeter. That's the most frequent number that you usually have. It shows that baby is starting to get the cervix to dilate, which is very normal that late in pregnancy, but nothing's really happening. Now, if you're 39 weeks, you might be thinking that it's too late to get a birth class in, but I'm here to tell you that I recommend a high quality birth class that just takes like 3 hours. In fact, you can shove it in, to your breakfast and dinner routines and get it done very quickly. It is not too late. I'm going to link that birth class down below. And I want to be clear that even if your cervix is closed or 1 or 2 centimeters, this is all very normal. I know all of you are focused on the people that had their baby at 37 weeks or went into labor early, but the average time is past 40 weeks of pregnancy, especially on your first baby. So it's very normal to not be dilated and not really be feeling any labor symptoms. That is the bad news. And I also want to remind you that when your provider checks your cervix, there's a lot more to an exam than just the numbers. Often they'll say your cervix is 1 centimeter. They might say that it is, 20% effaced and that baby is -2. And that refers to how high or low into the birth canal the baby is. The negative numbers, baby's higher. The positive numbers, which it goes up to like +3, +4, means baby's almost coming out, which I hope that's not what they find when you're in the doctor's office. But there's more to those exams than just the numbers. It's how softened your cervix is. It's where it's positioned in the pelvic vault. There's more that we learn from a cervical exam beyond just those numbers that they tell you. And, it's hard to really tell that to you unless you've checked thousands of cervixes. And of course, this information comes from me seeing thousands of patients during my 20 years in labor and delivery, along with being pregnant 3 times my own. And I was overdue every single time. So I was always frustrated like this. Plus talking to millions of pregnant people online. I think it's so good to get this from a well-rounded source. And here is the really crazy news. Just because your cervix, even if it's like closed, thick, high, like no signs of labor, is like that, that doesn't mean that in a couple hours with, you starting some good contractions, it can't change. It's just the way that it is. You've got to realize that it is labor that makes that cervix dilate, and it can honestly happen at any point in time. I actually have a video with the 3 agreements that your body needs to make to go into labor. I'm going to link that one down below because it can be really helpful. I think a lot of us put far too much pressure on ourselves that there's something that we could be doing to put us into labor. And I think that video kind of puts that to rest and reminds you that I wish that I had pushed less pressure on myself. I hope you're not putting pressure on yourself because there really isn't much you can do about putting yourself into labor. Now, what you can be doing is getting stuff done. If you're 39 weeks pregnant, the more you can do for baby and around the house, the better off you're going to be. I have a whole 39-week checklist that you guys can go through. I'm going to link it up above and down below. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.